whether or not we have now entered stage 3, community transmission, not just based on our ground report, but also based on what all of you are seeing and hearing. And let me just start with that question to you, Dr. Malhotra.
So it is now becoming quite evident that the contact tracing is becoming more and more difficult. And that is compounded by two facts. One is the large number of asymptomatic carriers or asymptomatic persons who have not got the disease. And that transmission, as we have seen, is getting more and more important. So in view of that, I think the spread which is occurring because of people who are apparently all right is the big key question here, whatever you want to label it.
Oh, I see. Dr. Ballal, have we entered community spread?
Good evening to you and all the panelists. What we have seen that has happened in our country is we started off with the disease being widespread across the country. Now what we see is it's sort of more in 4 states rather than the rest of the country. And some of the states, especially Kerala and to some extent our state of Karnataka, we hardly see any cases and certainly no fatalities. I think I would leave it to the epidemiologists to say whether it's entered stage 3 or not, but it certainly appears that contact tracing is becoming difficult and 1 or 2 individuals seem to be spreading into a large number of people. But since it's confined to very few states, hopefully they'll be take measures to contain this disease further.
Right. Dr. Thakkar, let me just take that question quickly to you before we widen the scope. Same question. Are we now in stage 3?
I am a clinician and not an epidemiologist, but the fact remains that my numbers are going up. I'm hands-on seeing patients. I'm not worried about which phase or which stage we are in, but I know for a fact that we are getting patients by the hordes. I'm in Maharashtra and in Mumbai, which is the epicenter.
Absolutely.
What we are finding ourselves in the predicament today is a result of what we behaved yesterday, and what we do today will tell us what we will manifest tomorrow. Right. I don't think the asymptomatic problem is going to settle down. It's going to get worse. My panelist is absolutely right. So we have to come to grips with it and move on ahead rather than looking back at which phase we are in.
Okay. Okay, then let's now come down to brass tacks. Dr. Malhotra, all of you are saying labels don't matter. It doesn't matter now which phase we're in. It's really how we tackle it. But each phase, I suppose, demands a different response. So suppose we're in this phase where, as you said, there are people who are asymptomatic. It's becoming harder for authorities to trace who infected, in a sense, the patient X. What do you do then? What strategy, if at all, should we be changing to how to fight this disease?
So I think before I answer that, I'll just make a quick comment. I think we all keep on talking about travel history. I think it has become absolutely irrelevant now, since that we haven't had travelers from overseas for a time much longer than what it takes for the person to actually get recovered. So I don't think the travel history is going to yield anything at this point of time. I think to some extent we'll have to start thinking that a person coming from a very high concentration of cases is possibly going to behave much the same way and should be held as a suspect as it was when somebody who came back with a travel history, whether or not he had a disease. Now, I think the profiling, the district profiling or the state profiling as per, see, we are a huge country and every state, like it was said by my panelists, that has different numbers. And some of the states are better equipped to deal with it, like states like Kerala, which have dealt with Nipah, or states like Odisha, which are so adept at handling the natural calamities. So we have different things. So we have to have a strategy which is applicable all across. And for that, I think we have to concentrate on the numbers. So wherever there are large numbers, we have to just contain them, quarantine them, test them, do contact tracing within them, and keep a watch. Isolate them better, keep a watch on those who are worse. And those areas which are relatively preserved can be kept pristine as far as possible.
Without again getting into labels, whether we're in phase A or B or C, what do you see really unfolding in Bombay? Because as you said, you're in the heart of it. What is leading to this constant surge?
I've had 2 patients admitted today, an elderly lady who is 76, who has arthritis, who hasn't left her home for the last 6 to 8 months. And she turned out to be COVID positive. As it turns out, the maidservant looking after her goes once a month to her house to give the salary that she earns. And she then tested positive and she gave it to the old lady. So I would categorize the susceptible people, the elderly people into one category, and the asymptomatic young people who could be the spreaders, who will be the spreaders, and contain them right. I think we haven't really learnt our lessons of social distancing. We saw it in Bombay for 2 days when the liquor shops opened, when the migrant trains ran, and people really think this is a joke. They think they have to hide from an unseen, unheard, unfelt enemy, and it'll go away like Cinderella whose dress will change at midnight. In fact, when we unlock, we're going to get worse because people will think now the trial by fire is over. That's when trial by fire will start. You'll have to have proper distancing unless you crack the whip, unless you inject panic and fear and not apprehension as people have now. It's going to be difficult because we are a 1.2 billion population. Not everybody knows the impact. As my partner and colleague correctly said, we are not having a high mortality. We are lucky. We have a lighter strain, a lesser virulent strain. But we'll have numbers. So that's important.
No, it is. Dr. Malhotra, if I have the time, just give us a sense, as we just heard from Dr. Thakkar, of the kind of examples of patients, cases he's dealing with, of the kind of patients you're seeing and what that is telling you about how the disease is spreading. Dr. Malhotra? Dr. Rajesh Malhotra, can you hear me? Dr. Malhotra? All right, Dr. Malhotra, we seem to have lost you, but I'll just quickly put that to you, Dr. Ballal, that based on your experience, again, talking to people in your different hospitals, are these the kind of instances that you're also coming across? People being admitted, no travel history, no prior contact history, and making making it all the more challenging.
Fortunately, the numbers are very, very low in Karnataka, and the government has been very proactive. In fact, we have a dedicated COVID hospital with 150 beds, and believe it or not, we don't have a single patient with COVID in that hospital, and it's open to the private, public sector and everyone. So the numbers are few, but we also run what's called as e-ICU and teleconsults for many of the district hospitals. And the numbers again are small, and not too many people are very sick, and the sick are usually the elderly with comorbidities.